Hello, my name is Cindy Shimaneski, and I'm here to do a demonstration on how to apply ACE bandage wraps to a lower extremity. So, the benefits of ACE wraps are for a number of reasons. If you get an injury, they are great to stabilize your joint and to promote healing. And they also manage swelling in a lower extremity, say an ankle or a foot. And they're also used if you have a wound on your lower extremity that needs to have a dressing over the top of it. An ACE wrap helps hold the dressing in place. All right. So, here's my lower extremity. And first I'm going to wash with soap and water and dry the foot and leg. And the reasoning behind this is to help prevent infection. So before you begin wrapping, you want to elevate your foot and leg on a pillow, or else you want to get someone to help you lift up the leg so that you can do a better assessment of like the heel and toe area. And it also helps with the wrapping. It helps promote All right, so I have my extremity elevated. I'm going to stand in front of my patient and I'm going to unroll the end of my ACE wrap. I'm going to start on the underside of the foot. I'm going to hold in place with my non-dominant hand, and then we're going to go around the underside and over the top, just like this. And you can see right on the inner portion of her foot, this going around and over the top is going to hold my dressing in place so that it is secure and doesn't become loose. All right, so our first technique that we're going to be doing is the spiral wrap. And there's two techniques that I usually like to do, and the first is a spiral and the second is the figure 8. So we're going to go under the underside and back around the top. And the spiral wrap is pretty much as it is. It's just a circular motion up until the proximal end of the leg. You're going to want to apply equal and even pressure the whole way up the extremity. So that's what we're going to do here. We're going over the top and back around. We're going to leave the heel exposed, and we're going to go around the ankle and up again. And we're going all the way to the top. And we're going to ask our patient how they're doing. How are you doing? Are you doing okay?
Yep, very good.
Good. And then we're going to want to secure in place with, I usually like to do like paper tape or silk tape rather than the little spiky elastic deals that come with these ACE wraps. And the reasoning is we don't want to injure our patient more, and they can become dislodged in the bed, and then they're at risk for skin breakdown if they get poked by one of those. Okay, so we're unwrapping. The next technique that I'm going to show you is the figure 8, and we're going to begin. We're going to go again around the underside, hold with our non-dominant hand, and go over the top and back again. Now, the difference between this is when we go under the bottom and then over the top, we're going to go in an upward motion and then go around the ankle and then come back around on the front portion of the foot and then go back down. So we went up, around, and down again. And then we're going to want to repeat that step, this time going a little bit further up. And then down again, up, around, back, and down again, around, up, and then back, down and around, and then up again. Oops. And then we're going to want to take a piece of tape and secure in place. The reasoning for the figure 8 is it really does promote fluid return into the venous system and decrease swelling and pain pressure as well. Some of your assessments that you're going to want to make on a patient that has an ACE wrap is we're going to want to check for tissue perfusion, and that it can be evidenced by capillary refill. So I'm going to feel her toes and they feel warm. They don't, but and then we're going to want to poke the top of her toes, and that tells us if blood supply is getting to her toes, and they are, and we're looking for blood return less than 3 seconds, and that is present. We're also going to want to assess for other signs of blood return, and that is any signs of pallor or cyanosis. We're going to want to look for pink skin, good healthy pink skin. We're also going to want to look for increased swelling in her toes or anywhere else. That can be a sign that our bandage is too tight, and we're going to want to loosen it. And then if she does have a wound underneath here, we're going to also look for signs of drainage, because that may mean that we need to reinforce the dressing underneath the bandage. Okay, we're going to want to ask our patient how they're doing and if this is comfortable. Are you comfortable with this?
Yep, very comfortable.
Okay, great. And we can be on our way. And thank you for tuning in. This has been my demonstration of ACE bandages.